Okay, so in the bathtub, for the legs, knees, and hips, I like to start with the calves. The calf muscles are on slack with your feet flat on the tub, and I like to use a gripping motion, a light clasping motion with my hands, and shake from bottom to top the calf muscles. This helps loosen them up. The warm water helps loosen all the muscles up, really. Again, going from bottom to top, shaking the muscles. You can do them both, but I'm getting a little tired, so I'm going to switch activities, and I'm going to include the shin muscles here, and I'm going to use the area of my hand here to clasp them. Now the shin muscles are very flat, so you're not going to get them shaking like you are the calf muscle, but I am getting some motion and loosening the front of the shin. Using both hands together, again from bottom to top. And so what I like to do is do a little, rest a little, do a little, rest a little, because it's a little tiring. So just by changing legs, I've changed how my muscles are working, and you know, it's a little less tiring. And I might go back 2 and 3 times to the calves to work them. But I'm going to give them a little rest because that's a little tiring. Now I'm going to work on the thigh. And again, stroking motions of the thigh. Gliding, stroking to help the circulation. I'm getting the beneath the knee, the above the knee, on either side of the knee, just to improve the venous and arterial blood flow. Now I'm going to do a little vibration on the thigh. I'm rolling the muscles. Again, I'm using a clasping motion. And I'm really massaging the large muscles of the thigh. Now I'm going to go for the underside now and work the hamstrings with the fingertips. There's an artery that goes from the front to the back and then carries down the leg. So by working this area right underneath the thigh, upward, you're improving the blood flow to the lower leg. I can spend a little time underneath the knee, and there are lymph glands there as well as a artery and vein. And I'm just again doing this gently to the back of the knee. I'm also loosening the hamstring insertion right at the back of the knee. And then I can go back to a little larger rolling motion. And then this area tends to get very tight, and sometimes the hips get very, how can I say, a little tender and a little tight right at the hip joint. So I like to take and roll the flesh in my fingers along the side of the hip and actually get my fingers rolling around the tissue, loosening it up. Especially if you feel a little lumpiness or hardness in the hips, you'll know you need to work it a little bit longer or come back to it a second time. And you'll find that it continues to loosen. And then I might finish with another bit of stroking. probably nice to say that the vein comes back up and returns into the artery up here. So light strokes on the inner thigh here assist the circulation return to the leg. Now sometimes if you're having a little knee pain, what you can do is do a little focused work on the knee, just with your fingertips, not too heavily, but a little bit of stroke like this with the fingertips. Again, too deep a pressure actually reduces circulation. The way, direct pressure causes bleeding to stop. It causes a constriction of the blood vessels. So, and now we're going to do a little focused vibration, just using the flat of my hand as it contours around these little handles right on either side of the kneecap. You'd be surprised, even when you're putting your lotion on in the morning after a shower, if you spend just a little time stroking areas that are tender, you'll find that it improves them, especially if you haven't waited weeks and weeks for a little attention. It can resolve things in a very short period of time. So that's all for the massage portion.